Welcome to IVF discussion on Multi Global Magazine TV. I am here with Dr. John Olutola.
Thank you very much for inviting me to come and speak on this topic.
Sir, as a gynecologist, can you tell us the meaning of IVF?
Yeah, thank you very much for your question. When we talk of IVF, IVF simply means in vitro fertilization, and is one of the techniques, is one of the assisted reproduction techniques which has actually revolutionized the practice of medicine.
Okay.
And since the birth of Louise Brown on the 25th of July 1978 in UK, the first IVF baby that was born in the world.
Wow.
And that was a landmark for the treatment of infertility.
Okay.
And that has actually helped to revolutionize and put smiles on the faces of women who have been tagged not to be able barren or not to have children. But with the advent of IVF, I told you it's assisted reproduction. There are other methods, but the commonly one we do now is IVF. We have so many other things in assisted reproduction technology. So because assisted reproduction technology means it's just a kind of a treatment, fertility treatment for couples other than sexual intercourse. Okay. Because we all know that before there can be conception, there must be sexual intercourse between a man and a woman. So any other forms of treatment than sexual intercourse by which a couple can attain conception is said to be assisted reproductive technologies, in which in vitro fertilization, IVF, is one of them.
Okay. Please tell us the categories of women that can go for IVF.
Yes, now with that, what we call indications for IVF, it's not just you wake up and say, I want to go for IVF. Usually, IVF is usually the last resort after you have been duly examined, investigated by a gynecologist.
Of course.
Because I have had patients, maybe after 3 months of marriage, they quickly say they want to go and do IVF. 3 months, 6 months, without even being duly investigated. And it's more or less like a waste of money, and which is not too advisable. But you must have been investigated and examined by gynecologists who will decide that you are eligible for in vitro fertilization.
Okay.
And one of the key things is a woman indication is that, for example, now a woman with tuber blockage is a candidate for IVF. Because we all know that fertilization takes place in the tube, in the fallopian tube of a woman. So when the two tubes are blocked, there is no any other way of conception, because where the sperm and egg are going to meet there is a partition. The sperm is coming, the egg is coming, they can never meet, and such a woman cannot get pregnant. So anyone who has tuber blockage is a candidate for IVF. Any woman who has maybe endometriosis, that's what we call endometriosis.
Okay.
So is also a candidate for IVF. Also, age is very important, because now we have a lot of issue with delayed in conception. Today now you see some ladies who are not married because a lot of delay married, maybe because of career and some other issues. So people attending, they are married. Many women are married late now these days, and some of them, by the time they get to 40, that is when they maybe get their future partner, and what do you do at that time? Their reserve is already gone. So the only way out is for them to go through IVF, because the natural biology cycle is already gone in every woman once we are over 37. So the only way you can have a way of having children is to go through IVF. Or a woman that has gone through that maybe you have investigated and we now find out that you have unexplained infertility. Unexplained simply means we have investigated the husband, we have investigated the wife, and we could not find any particular cause for the delay in conception. Why are you having? Because both of you are fine. So we just call that unexplained infertility. So for you to be waiting endlessly, we advise you to go for IVF. Women who maybe they have lost their womb due to maybe surgery or some cancer, they could go for assisted reproductive technique. It might not be really IVF. Or women who cannot carry children, these are people that we have to, for example, you cannot carry pregnancy, you have to use surrogacy, but usually IVF have to come because surrogacy, because you can be a surrogate. It's not the husband that want to have sexual intercourse with you. You must also go through IVF too, and then so that the baby can be transferred into the surrogate. So these are the candidates. So it is based on the assessment, the evaluation of a gynecologist, having done all the what is necessary, because some people are impatient. I've seen patients who just go and do IVF, it fails, and after the next one they got pregnant naturally. So definitely initially, that means ab initio, they might not be a candidate for IVF, but because of impatience they go for it. So those are the kind of patients that could have IVF.
Okay, sir. From your explanation, sir, is there any age limit of women who can go for IVF process?
Now, as of today in Nigeria, but there is no particular age limit. Okay. I have to be sincere with you. But I can tell you that our practice differs. There are some centers, once you are above 55, they will not offer you IVF because that is their own policy in that place, because they feel that we have had women who are at the age of 65, they've gone for IVF. Okay. So presently there is no age limit, in as much that you have an intact womb that can carry pregnancy, yes, irrespective of your age. But it now depends on the policy of centers. Some people they don't want to record failures. That's why some people try to put an age limit. Okay. Because the older you are, the less likely that it's going to successful. So I have a center where I have sent patients to, and they come back and say the woman was over 60, and they said their policy is that anybody after 55 we don't want to offer. Please, we are sorry. So because by the time you offer to 60, 70 and you are failing, it's not speaking well of your center. So people will say that they are not doing very well, but so they have actually screened out some people that might quickly give them problem or not add to them. Okay. So for now, there is no age limit. It ranges from any age of reproductive age. Okay. Because you might be 25, have challenges. It doesn't necessarily mean somebody who is older that we have IVF. That's the conception. I've seen people who are 30 years, they have challenges in concept, maybe the tuber blockage. They have to go for it. So presently, there is no age limit, but anybody can be offered IVF when they so desire.
And while you were analyzing some things the other time, I picked something regarding the cost. Now, I want to know if the cost, is it affordable to everyone?
Thank you very much. I think when you talk of affordability, affordability is a relative term, because what could be affordable to you might not be affordable to me, another. Yes. So we cannot generally say that is it affordable. I know some people who can afford, even if you call it any amount. But when we look at the general population and the economic situations and the economic downturn that we have, yes, I would want to say that to average Nigerians or to average people, I'm not talking of the high class people, for the average people, it is not affordable, because the cost is so high. When we talk of IVF, in the past, it used to be 1.5 million in some years back. When they first started, you can even have 700,000. But now, it ranges as low as 3.5 to as high as 7.5 million for a cycle of IVF. Lowest as at 3.5 million. So you must actually determine the cost before you embark on it, because even having paid so much money, there might be some other additional things that will be added, okay, that they will ask you to pay for it. So So many things are into it. They just tell you the conventional IVF, because we have what is called the conventional IVF, where it's just this. Then there is other additional things that can be added to IVF. Do you understand what I'm saying?
Yes,
There are
I
other
do.
things that need to be added to IVF.
To
It might not be.
IVF.
There's what we call conventional IVF, and there are some that we just have to. They are not conventional because we need to do some modification. So based on the peculiarity of the patient we are dealing with. You understand what I'm saying now? There are some patients. That's what we call ISCI, intracytoplasmic sperm injection, in which you will have to, for example, now the husband has a very low sperm. You cannot even get so many sperm. So
That's the
apart
low sperm
those so
count.
low one that is poorly low, not even the other severe one. So ordinary IVF will not work for that patient. They will do the IVF, but they will tell you we are going to add ISCI to it. ICSI, ISCI. We are going to add it to it so that it will be able to get results. So in such a case, they will add the money for ISCI being added to IVF. So that will make it more expensive. So 3.5 to as high as 7.5 people are paying. So if you look at it in a real sense, it might not be affordable for average people.
Average people.
And that is why we are looking, we've been talking about people who can government coming into government
NGOs.
and government hospitals coming into it, because
Yeah.
most of the IVF centers are in the hands of the private,
Okay.
and that is why it is so expensive. It's not something you just walk into any government hospital, federal government hospital. I want most of them, they are more in the domicile in private, and private will be definitely more expensive than government. So